Hey there! Welcome to Let's Make a Health Connection. In this podcast, we introduce, interview, and showcase the many healthcare providers and resources that we feature on our website, localhealthconnect.com. I'm Jennifer Barber, and I'm a licensed clinical social worker in Washington and Oregon, and I'm happy to be part of the Local Health Connect provider community. Today we're talking to Megan Dye. She's a psychiatric mental health nurse practitioner with additional certification in perinatal mental health. She's been a registered nurse since 2008, a nurse practitioner since 2012, formerly worked as inpatient on the psychiatric consult team for Legacy Health, and she's been in private practice since 2016, offering telehealth since 2020. She practices in the state of Oregon and in Washington, and her hobbies are swimming, wakeboarding, coaching softball, did not know about that, Megan, and fish keeping. I also didn't know about that. You're kind of an interesting person.
I appreciate that. Thank you. My hobbies are varied, that's for sure.
Welcome to the podcast. I really appreciate you coming on and just kind of participating in this meet and greet and allowing people to get to know you just a little bit better.
My pleasure. Thank you.
So let's talk a little bit about your practice, and if you could tell us just a bit about like any specialty populations you like to work with.
Sure. My private practice has been such a joy because I really do get to hone in on things that are of interest to me or holes that I see that really need attention. And the start of my career was really focused on inpatient and acute mental health. And my original love has always been first episode psychosis, early severe depression and anxiety, and late teens, early 20s. And I think that has guided me in a lot of ways to be able to practice in an outpatient setting by seeing emergencies. But it really truly is a joy of mine to go in early, to communicate with parents, and to really try to navigate early resources for patients having emergent psychiatric symptoms. And primarily that is late teens to 30s.
Mm-hmm.
I transitioned a little bit as I had my own children and my interests changed a bit to women's mental health, but specifically perinatal mental health. And that involves anything from pre-pregnancy planning through several years postpartum, with all of the nuances that come with treating during that period of time. And it's not just women, but ideally I would see someone before they were pregnant. We'd talk about medications. I'd see them throughout their pregnancy, talking about hormone fluctuations and body fluctuations that influence medication. And then I also feel very prepared postpartum to help support those patients in what can be some of the most difficult months for their families. And that really is where I've put much of my effort over the last 5 years.
Great. I think it's really important. Let's just take a moment to talk real specifically about the role that you play in mental health. As a mental health nurse practitioner, are we talking specifically prescribing medications, or are we talking prescribing medications and mental health therapy, mix of both?
So that's very much a provider choice. And I think certain institutions prepare one way or another a little bit heavier. And then from there, you can do continuing education to support. My preference for my practice is to do primarily medication management. I am certainly trained in basic therapy, but I do not consider myself a therapeutic expert, which is why I really reach out to community teams to provide that level of support, because I want my patients to have the best of everything. And then I can spend my time really looking at the nuances of medication.
Mm-hmm. This may seem really simple to some people, but maybe not to others. You sent me a list of questions that you were prepared to answer, and this is not one of them, but I think you can handle it. If someone were working with a primary care doctor and they were seeing this doctor and realizing, I feel like I have some depression, some anxiety, or maybe like struggling with a new bipolar diagnosis, why would someone reach out to a mental health nurse practitioner instead of just working with their primary care doctor?
That's a really great question, and one that I actually get quite a bit. And I think general practitioners, thank goodness for them, but they are in a position where they need to know a little about a lot of things. And it also is, a bit dependent on their preference. Some really focus on mental health, and some have just had much less focus or less training on this particular avenue. With psychiatric medications, we can do some damage if we don't accurately diagnose when we prescribe things. And so a very straightforward case of something like anxiety or situational depression can be easily managed in primary care. My hope is that primary care sees when something is not very, very clear, that there are great nuances that really do need a specialist. Like with anything, I don't think primary care would take over cardiac care in the same way that they wouldn't take over psychiatric care. And, one downfall is we have such a shortage of mental health providers. And so, again, so thankful for primary care getting in there and trying to do it. But I think the nuance and the education that comes with a specialist really makes for long-term wellness.
Great. Thank you so much for answering that question. So in the introduction, we spoke about you offering telehealth since 2020. Is that strictly all you're doing is telehealth, or are you seeing people in person as well?
As of this fall, I am strictly doing telehealth, though I do have the option to use an office. And I was actually quite torn about this decision. I have seen a few patients in the last few months, and I miss the feeling in the room. I miss touching my patients, even just for vital signs. I miss the ease of not having to send things electronically. That being said, time and time again over the last 2 years, I have been repeatedly thanked for the availability of telehealth. And I've been told by multiple patients, I would have never come to see you. I would have never taken this chance to get well if you did not offer this video option because of my anxiety or because of my transportation issues. And so I think it is doing much more good than harm, but I do miss that direct patient interaction.
Great. Thanks for offering that. Tell us a little bit about your integrative care approach to mental health.
I feel really strongly about this, and I actually do a lot of work kind of outside of clinical appointments to create community resources for my patients, and then professional dialogue with other providers, because this is not a one-stop shop for wellness. My patients need assistance with things like nutrition, certainly with expert level therapists, naturopaths, and this is hard work. This is all things that, in certain ways I'm researching on my own, to offer to my patients. And so the more on the team, I think usually the better. And I just want to know where my limitations and specialties are versus what I can offer to them that is not straight pharmacology.
Great. I have to say, just in my own personal experience as a mental health professional therapist, working with you as a prescriber, you have been so important. Yes, you're important. That's not the word I'm looking for, but it has been a pleasure to work with you because you are such a team player. You are available. You're easy to reach. If there's, this is just, I wanted to call that out because I think that's not always the case with other members of teams.
I really appreciate that. That feedback is very welcome because that is what provides optimal care.
So great. Thank you. Talk to me a little bit about your passion for services to frontline workers and teachers.
Always, frontline workers have been on my mind because I've been there, we were there, we are there. And I feel like as providers or anyone associated with the healthcare system, we need to be well. And so we need to support each other to be well. I love working with medical providers because the knowledge base is there and we can talk about things that are very detail oriented, but I also understand when my patients talk about caregiver burnout and they talk about so desperately wanting to help people and not always being able to help people. And I think it's become blatantly obvious that we have always needed more support for our healthcare providers. And this is just when it has come to crisis. Um, Interestingly to me, I really wasn't expecting this. I just had never thought of it, but I'm seeing teachers in the exact same position. And I would say they are right there on the front lines with every therapist, nurse practitioner, physician that's out working during the pandemic. And their needs are very great. And we are not even close to supporting them enough in the ways they need. And unlike those of us in medicine, they don't necessarily know how to advocate for their health the same way. And so to me, that is a heartbreaking realization that needs attention.
Great. Thank you. So let's talk about new things on the horizon for you. What do you have that you may have just started getting into or things that you're looking forward to?
One thing that has really been on my mind lately that I'm just so happy for, I'm just so proud of some local clinics here, one particularly being the Vancouver clinic, is they are changing around how they monitor postpartum patients in an obstetric clinic. So these are not psychiatric providers. These are the OBGYNs and midwives who have come together to say, we need to intervene earlier on women's mental health. And the way that this is shifting is they are offering 2-week follow-up visits, which I have always done in my practice. But there are very few people who have had access to that before. I mean, this is coming to the masses versus waiting the full 6 weeks to catch crisis symptoms or more advanced depression symptoms. And so I'm encouraged that mental health is being put on the forefront of postpartum care. And this is one little step in so many things I hope to come.
Great. Oh, that's fabulous. I didn't know Vancouver Clinic was doing that. So how exactly will you be a part of that? Can you just explain what that looks like?
So right now I'm peripheral, actually. I haven't learned this from my patients rather than directly from
Gotcha.
providers, though I do work very closely with some OBGYNs. And so even though I offered this service to my patients already, I'm really hoping, particularly at a local clinic, to get involved with making this mainstream if it is not already,
Great.
for postpartum care.
Great. Thank you. That's such a great service. Is there anything else you would like our community to know, either other providers to know about you or people who might be searching for a mental health nurse practitioner, prescriber in this area?
I think one of the things I notice is just the great frustration and fear about not being able to get a mental health provider. And I wish I had more answers to that. But what I would say for the community, certainly start with a primary care provider if you need referrals within a clinic system. They are increasing services like psychiatric mental health through clinics like Vancouver Clinic and Peace Health. And I think that most patients don't know about that. We also have access to community mental health services for those that do not have private insurance and cannot be in a private practice setting. In terms of getting follow up in the community, don't take if you hear that somebody's full, don't leave it at that. Say, do you know anybody else who's accepting patients? Or start care with a therapist and say, do you know a prescriber? Vice versa, start care with a prescriber and say, do you know a therapist? Because oftentimes that is way to get access to care. And as community providers, this has been my goal and it has helped with my success in private practice. Communication and collaboration is gold.
Yes.
It is essential for good care and it's essential for our health and our practice.
So great. Thank you. Thank you so much. Megan, I just want to say thanks again for being a part of this today. And if there's nothing more, we will sign off.
I appreciate you. Thank you.
Thank you. Bye-bye. Thanks again for listening to Let's Make a Health Connection. Find us online at localhealthconnect.com as well as Facebook, Instagram, and Twitter. Links and show notes for this interview are available on our podcast page. These interviews are really fun, and I hope you made a health connection today. We'll talk again next time.
Let's Make a Health Connection, copyright 2022, all rights reserved, is the exclusive property of MBS Therapy, LLC, a Washington-based company. Local Health Connect is inclusive and does not endorse any political or religious group. Thank you again for listening, and we'll see you next time on localhealthconnect.com.